Hello everyone, welcome to Physioversity by Bornonagar Physiomax Association. In the last video, we have discussed about the primary muscle of inspiration. In today's video, we are going to discuss about the accessory muscles of inspiration. So as we know, there are so many accessory muscles of inspiration, we will discuss one by one. The most strongest accessory muscle of inspiration is the sternocleidomastoid. The muscle has two heads, okay. One originates from the sternum, another originates from the medial border of the clavicle. Both the head fuse into one and inserted into the mastoid process that is behind the ear. This muscle is supplied by the accessory nerve and second cervical nerve. Now, if one of the muscle is contracted, or you can say if one side of the muscle contracts, then what happened? So suppose one side of the muscle has been contracted, so the head will go into the same side flexion and the opposite side rotation. Okay, same side, the action of the muscle is same side flexion and opposite side rotation. And if both sides of the muscle contract together, then the head will go into flexion. If the head is fixed, then the muscle helps in elevating the sternum, increasing the anteroposterior diameter of the thoracic cage. And we can see or observe the contraction of the sternocleidomastoid in case of patients who are dyspneic or in case of forced inspiration. Another accessory muscle of inspiration is scalene. The anterior, medial and the posterior scalene are separate muscles which acts as a one functional unit. These muscles are attached superiorly to the transverse process of lower 5 cervical vertebra and inferiorly to the upper surface of first 2 ribs. These muscles are innervated by the spinal nerve, cervical spinal nerve. Another accessory muscle of inspiration is serratus anterior, which is also known as boxer's muscle because of its action of arm, that is forward pushing of the arm. It is also known as boxer's muscle. This muscle arises from the outer surface of the first 8 to 9 ribs. Then it goes backward and forming a sheet of muscle which inserts into the medial border of the scapula. This muscle is innervated by long thoracic nerve, that is branches from C5, C6 and C7. Now this is also known as accessory muscle of respiration, as it helps in increasing the anteroposterior diameter of the thoracic cage by elevating the ribs through which this muscle is attached to. Pectoralis major is one more of the accessory inspiratory muscle that arises from the sternum, clavicle and the cartilages of all the true ribs. This muscle covers the anterior chest and sweeps around the anterior part of the chest to insert into the intertubercular sulcus of the humerus. This muscle, or the pectoralis major muscle, is innervated by the medial and the lateral pectoral nerve and the cervical spinal nerve, that is C5, C6, C7, C8 and T1. Now, what are the function of this pectoralis major muscle? The function of pectoralis major muscle is medially rotating the arm as well as draw the arm around the chest. Not only this, during climbing up, this muscle helps in drawing the trunk toward the arm. During forced inspiration, this muscle also helps in elevating the rib cage by drawing the rib toward the arm while the arm is fixed. Trapezius, which is a diamond-shaped large muscle, is also known for its accessory action in inspiration. The upper part arises from the external occipital protuberance and it inserted into the posterior border of the clavicle. The middle part arises from the diamond-shaped thin tendinous sheath, the supraspinous ligament, and the spine of upper thoracic region. This part inserted into the spine of scapula. The lower part arises from the supraspinous ligament and inserted into the spine of lower border of the spine of scapula. This large muscle innervates by the spinal part of the accessory nerves and cervical nerve root C3, C4. Its main function is to rotate the scapula while elevating the arm, as well as shrugging of shoulder. Not only this, the trapezius muscle also acts as accessory muscle of respiration for its stabilization action of scapula. During stabilization, the pectoralis major and the serratus anterior muscle can elevate the rib and help in inspiration. The next accessory muscle of inspiration is the pectoralis minor, which is a thin muscle that arises from the outer surface of third, fourth and fifth rib near their cartilage, and it inserts into the coracoid process of scapula. This muscle is innervated by pectoral nerve C6, C7 and C8 nerve root. Contracting with serratus anterior, the muscle helps in drawing the scapula toward the chest. Not only this, during the forced inspiration, the pectoralis minor helps in elevating the ribs through which they are attached. Erector spine. Erector spine is a long and large muscle which extends from the sacrum up to the skull. Okay, this originates from the sacrum, iliac crest, lower thoracic and the lumbar vertebra, and it inserts into the towards its journey, it inserts into the spine of spinous process of the vertebra. This muscle divided or separates into three columns like lateral iliocostalis, intermediate longissimus and medial spinalis. These muscles are innervated by the related spinal nerves. Erector spine muscle helps in extending the vertebral column, rotate it as well as laterally flex it. Now during forced inspiration, the muscle also help in extending the vertebral column, help to more elevate the rib cage or thoracic cage. So this is all about the muscles of inspiration. In the next class, we will discuss about the exhalation process and the abdominal muscles and how this abdominal muscle helps in the respiratory process. Till then, like, share and comment on this video. Don't forget to watch the other series of this channel and subscribe the channel to know more. Thank you.